Department of Health confirming there are now 15 cases of monkeypox in the state, and vaccines for the virus are now available in our area. Thanks for joining us for your 5 News at 6. I'm Erica Thomas.
And I'm Darren Bobb. 5 News reporter Catherine Gilker spoke to the Arkansas Department of Health about the virus and who should get vaccinated. Catherine?
The Arkansas Department of Health has a list on their website showing locations where the monkeypox vaccine can be got. Some of those locations haven't received their shipment just yet, like 2 locations in Springdale. ADH tells me they should have their doses by the end of the week. Of the 15 confirmed cases of monkeypox in Arkansas, ADH says those are all among men who have had sex with other men, which is consistent with what is happening on a national level.
We do anticipate the number of cases will continue to increase, and for that reason, we are offering vaccine doses to people who have known exposure to someone with monkeypox.
Dr. Jennifer Dillahay says people who have been at an event or setting where monkeypox has also been known to spread can also get the vaccine. Currently, the ADH unit in Washington County is the only place in our area to get the vaccine. Community Clinic in Springdale, as well as our care in Springdale, should have the vaccine later this week. She says there will be training on how to give doses so the vaccine we have can go further.
We've been working with pharmacies that have good connections with the LGBT community so that they're able to communicate directly to their patients that it's available. I think that's important.
Dr. Dillahay says this virus spreads most commonly from direct skin-to-skin contact with the infection. She says if the vaccine is given within about 4 days of exposure, it's possible it could prevent the illness. And if taken up to 14 days after exposure, it could make the illness milder. She doesn't think parents should be concerned because no children have been infected in Arkansas and said it is very unlikely to transmit in schools. The rash starts out as a red area that starts out flat and then raised.
It forms vesicles, which it's like a pimple, but it's got clear fluid in it. And so that could look like a chicken pox and may be hard to distinguish at that point. It progresses to be pus-filled, so it's called a pustule.
Symptoms of monkeypox can include fever, headache, and muscle aches, as well as swollen lymph nodes, chills, and exhaustion. But the telltale sign of monkeypox is a rash that looks like pimples or blisters. Catherine Gilker, 5 News.
All right, Catherine, thanks. In Oklahoma, the CDC reports 11 confirmed cases of monkeypox across the state.